Good evening, and welcome to the Care and View, the online health and social care platform, free for everybody working, living, anyone who wants to know anything about social care. Before we get started, if you're watching us on YouTube, don't forget to subscribe, hit that bell button, and you will always be updated whenever we load a new episode or content up. Find us on our socials, give us a follow, visit www.thecaringview.co.uk for all of our content and free resources, and find us on Spotify, where we have our exclusive podcast running pretty much every single week. We're in the middle of series 4 at the moment, all about developing ourselves as care professionals. This week we spoke to John Wilkes from the IHSCM. Next week we have Jane Townsend from the Home Care Association, and we are closing out the series with Martin Green the week after next. So do make sure you go and check that out. And that series has been sponsored by Florence. So huge thank you to Florence for making that possible for us. So, Mark, good evening. How are you?
Yes, not too bad, thank you. How are you?
I'm good. I swear that intro gets longer week after week after week. Might just replace the intro video with something in the future, because we just feel like we're doing so much and everything's just, I mean, you know, we weren't supposed to be doing a show this week because we're at the Care Manager show this weekend doing 2 shows, which is bonkers. So it's just mad how busy we are.
The Care Manager shows come around so quickly. It's insane. I think about a month ago we were like, oh, it's still about 4 weeks. And I swear I went to bed and I woke up and it's just, here.
It is mad. So if you are coming to the Care Manager show, we will be opening up the entertainment stage on both days, which is incredibly exciting. We have a free giveaway going off on our stage, and we have goodie bags for every single person who will be coming to watch and listen to us. So please do make sure you come down and check us out at the entertainment stage. Mark. So before we get into tonight's show, so I did on my LinkedIn. So if you don't follow us on LinkedIn, please do. I did a post yesterday. Realized it's been 5 years almost since my dad died, which was crazy. And it got me thinking about selfishness and how we need to, spend time with our families, because one day they won't be here and our jobs will always carry on running. Today, I have another metaphor, and it's about owning up to mistakes and, being not ashamed to say you've made a mistake. My mistake of the day was painting my entire upstairs lime green. It was hideous, horrible, horrific, putrid, wrong on so many levels. So all I want to say today is, if you are a manager listening to this, don't be afraid to own up to mistakes, because had I not owned up to that mistake, I'd be living with a lime green upstairs. No, it's now white at this moment in time until we can decide on what colour to go with. So never be afraid to own up to your mistakes. It's a lot easier than living with them. I can tell you that. Oh, yes, Hillary Woodhead in the comments. I love lime green. I do too. But it was, put it into perspective, my other wall's like hot pink, and hot pink lime green. it really wasn't gelling. It wasn't gelling whatsoever. No matter how much artwork and pictures I put up, it would just be horrendous. So, Mark, tonight's show, what are we on?
Yes, so tonight we're talking about the amount of money that care providers are owed from local authorities or from the ICB or continuing healthcare funding. So I think we'd kind of had conversations, and we're joined by Care England tonight, and they'd also had conversations with providers around kind of payments that people were waiting on and the impact that was having on their business and the financial stability. And we came together with a survey that has gone out across England, across Scotland, just to try and capture the impact. So tonight's going to talk about kind of some of those findings, what the impact is for care providers, what we've kind of heard from some of the managers and from directors and owners of businesses, possibly touching on kind of what support's out there for you to, tap into, and really just to kind of have that conversation and to raise awareness of actually there is that whole myth that care providers are making millions of pounds and they're conning people because, it's a niche market, but actually it's the other way around. There's actually care providers that are closing their doors and having to say to people, we can no longer provide a home here for you because actually we can't afford to pay the staff and we can't afford to, pay the utility bills. So yeah, I think the survey's been very enlightening, but I think it's a very important conversation to be had.
And it's really sobering as well. And I think for me, like Joni Mitchell, I look at things from both sides, and I can see both sides of the argument. And I think there was a show recently around evictions from care homes and how they're terrible and how they're barbaric and, care homes, evil, 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 which is fine. Revenge evictions do happen in some cases, and it is a terrible, terrible thing. However, most evictions or moving out or replacements or however we want to address the term happen because of a long list of issues, scenarios, other factors. And when we start thinking about the problems of social care, it's instantly social care providers are at fault because X, Y, and Z. However, what we need to start doing is looking below the surface and think root cause analysis. How have we got to this point? Because social care providers are usually the end point in these scenarios, and then they get burdened with the blame when actually there's probably systematic failures going on throughout. And if we can stop blaming each other and start working together to figure out where the system's not working, then maybe the public image of social care would improve, and that trust could then start to come back forwards. But we get very much single-sided stories. So yeah, this consultation for me was important because we could have the ability to say, look, providers are trying the hardest, but unless they're getting the money, unless they're getting paid, there's nothing they can do. Rocking a hard place, isn't it? So yeah. So guests tonight, we've got Care England joining us, haven't we?
We have. I guess we should bring Richard in. Hello, Richard. How are you?
I'm great, thank you very much. How are you both?
We're good. I'm good. And I'm a man of his words. I'm a man of his promises. I told you I'd do a rubbish introduction for yourself, Richard. So please do tell us who you are and where you're from and what you do.
I'm Richard Ayres. I'm a social care advisor to Care England. I support Professor Martin Green and his head of policy with all issues related to kind of funding, finance, data, numbers, lots of different projects. I've got a 25-year background in procurement for my sins. I've worked within care provision for 10 years as a care provider, supporting care provision for one of the large groups. And I've worked with Care England for about 10 years and worked for them for the last 2 years.
Thank you very much. Oh, go on, Adam.
No, I was going to say, no, that's fab. And I think, what better guest to have on us on the show tonight and, to work with us on this consultation and to really do this sort of this deep dive piece. Anyone who is watching, if you are going through anything around delayed payments, you are struggling, or you just have questions in general, please do bring them into the comment section. We'll address them as we can. It'd be great to hear from you. And if anyone would like to talk to us and actually want to talk about it openly in a public format, do let us know. Because we have got people interested in taking this further. And obviously, it's always great to hear from the people who are going through this. It adds that human element that we so sorely need. I'm no longer a registered manager. I'm no longer a provider. So I can't really bring that element to this. So we're here to support you. If anyone wants to bring it up in the chat, please do. So really, I want to start tonight then on why it's important that we're looking into this. And now, Mark, I know you gave a brief introduction about it earlier, but it came from a meeting we were having, and one of the providers in this meeting just broke down, just instantly broke down. Safe space meeting, it's absolutely fine, nothing's going to go anywhere else. And she basically just said, I'm struggling. I've just paid my staff and I've got $5,000 left in my bank account. I do not know how I'm going to make it to next month. I'm owed £60,000. What? How can you be owed so much money for care that you've provided? If you've been contracted for services and if you've been contracted to provide support, then you should be being paid for what you're doing. And for me, it really opened, and this was a home care provider, so it really opened my eyes to the vulnerability right now of social care providers. And that's what led us to think, well, actually, we need to do something now. We need to look into this and see where we can go. But Richard, I know this has been on the radar of Care England for a while. So do you want to give us a bit of a background of some of the work that you've been doing so far on this and some of your observations from Care England?
Yeah, so I mean, Care England, we speak sort of a unified voice for members of the care sector, and our members include organisations of various types and sizes, single care homes, small groups, up to large national providers, not-for-profit and voluntary organisations and associations. So we're regularly engaging with all of our members and non-members to understand kind of these issues and how they affect care providers. And as a result of the recent survey, looking at our own data and being able to understand, well, what is the impact of delayed payments on care providers? we were able to kind of come up with a number that's close to about just under £700 million of money owed at any one point to care providers for payments that are due past 30 days. So there are legal positions when you're dealing with the public sector that payment terms, unless expressed otherwise, should be 30 days. And we're talking about nearly £700 million worth of money outstanding beyond a 30-day period. And that will cost care providers, just at the Bank of England base rate, the equivalent of about £30 million a year. With interest, that could be anything up to 13% or £80 million a year. It's a huge amount of money, and it's local authorities and ICBs the same. Both of them have got challenges and issues with making prompt payments or dealing with the queries and outstanding challenges that we as care providers face due to the multiplicity of different ways that local authorities and ICBs get us to invoice for the residents that we have in their care.
Sorry, couldn't find the mute button then. No, I completely agree. And I was going to say, I was just thinking it, but Hillary has popped in the comments here. I'll bring it up on screen. She's put, it's a knock-on impact on delayed payments. Voluntary sector support services waiting for invoice payments for month on month and making it harder to build capacity and respond quickly to social care providers accessing independent support. And I think that's the thing, isn't it? Because, we're in a recruitment crisis at the moment and a retention crisis. And actually, if you are a small business provider and you're not getting paid, then you can't actually pass that on, to your staff, who are then ultimately just going to leave and go work where actually there is no payment issue, because at the end of the day, they've got, bills to pay and food to buy and mouths to feed and things. And I think that's what we found, wasn't it, Adam? When we were speaking to that care provider, they were literally going month to month to month with nothing in the bank until she was paid, taking all that money, giving it to her staff to pay, their wages and any of the bills.
And profit is, I don't know why profit has such a stigma around it. It's like such a dirty word, profit, when actually we need to be making profits to make sure we're viable and to make sure that actually we can reinvest and we can make sure our services can meet the needs and demands of anything that's thrown at us. And I know during COVID, people's reserves were wiped out because you would end up with 3, 4, 5, 6 beds empty for a period of time. Everyone was petrified of moving into care services. And for smaller organizations, it was wiping out our reserves. All of that money that we'd normally have had to go into supporting our staff wages because we couldn't just sack people. You couldn't just get rid of people and minimize it. You had to keep that team moving. You had to keep them going. And the money needed to come from somewhere. Yes, your beds get filled again and people move in, which is great. Those reserves, though, unless you've got a really, really profitable business, those reserves struggle to build back up. So you end up in this situation where you've not got as much reserves as you used to, and actually you're not being paid for the care you're providing. Boiler goes, stair lift goes, lift goes. What are you going to do? How are you going to cope? It's more than just being able to pay our teams. It's just being able to make sure that the services run day to day. So, Richard,
you're going to come in.
Yeah, no, I was just going to say, but it's a really important point because for every £1,000 of debt that a provider has, they've already spent between £600 and £750 paying their staff, paying their operational costs. And there's a statutory obligation on care providers to pay the national living wage from the 1st of April, but there is no statutory obligation for a local authority or an ICB to pay the providers on time. And that's a real challenge. And when we see payments that can be up to 11 months, and we hear some of them are more than 12 months overdue, the knock-on impact on providers is absolutely crippling. And some providers don't know how much money they're going to receive week on week, but they still have to pay their staff. SMEs, don't have the resources without overdrafts or borrowing to sometimes pay wages because, as you said, reserves are really depleted. And I think there was one provider I was talking to.
Oh, we have lost Richard momentarily. And I can imagine this was going to be a really important point that he was going to bring up as well. You're back, Richard. You're back. We lost you for a second. You got to the point where you said you've been speaking to a provider recently.
Yeah, so one provider we've spoken to was 44% of their income is over 30 days late, and 13% of their income is over 90% late. And I think we did some calculations that showed that for a group of homes which was around 200. They were owed 2.1 million of just ICB debt over 60 days late. That's an average of £10,000 per provider late. Or there's another way to look at one other provider that they've got the equivalent of about £1,700 of debt per resident that they have within their care, and some disputes taking 12 months or more to resolve. This is not sustainable for the sector.
No, it's not. And, the shoe's on the other foot, because I've been there where, say, your council's overpaid you or you've over-invoiced, they deduct it from your next lot of payments. They get that money back like that. However, and it's always the case, you send something back, you buy something, they take your money straight away, you send it back, and they'll be with you within 10 working days. If they owe you the money, actually, it takes a really long time to get it. And then it might not be accurate, and then there's I don't know whether it's an Oracle system or whatever system they use, never seems to work perfectly. And it just makes things a really, really difficult situation. I mean, Mark, I know you probably can't talk too much about it with your day-to-day role, but how much of a problem do you think this is for home care providers in general?
I think it's still a big issue. I think, I put my old home care provider registered hat on, and also the learning disability hat. And, I think the number of managers that are out there that would have started off as a care worker, worked their way up to management, that don't have kind of the financial background, but want to deliver good quality care. And they listen to social workers and the local authority or continuing healthcare or whoever it is, and they start delivering care based on an email or based on, some kind of message. And then they're providing that care, and before they know it, they've delivered care for a month, and then they think, oh, actually, we haven't been paid for this. Let's try and invoice. And that's where the problems come. And, it's exactly the same in home care. I think the only difference in home care compared to learning disabilities is that at least in home care, you're generally under one local authority or one ICB, whereas with learning disabilities, I look back at kind of the service I used to manage, and we were spanned across 4 or 5 different local authorities and people that had placed, residents within the service. So actually, you went from having, just your general contact in that finance department to having multiple different finance contacts and multiple different invoicing systems to juggle. And I think if you're a small care provider, as you probably know, Adam, from experience, is you're doing all of it. You're doing the invoicing, you're making sure that, the payroll's done, you're making sure that, you're on top of everything, that your staff are paid, that, you're supporting them if you can't, pay them. All of those things is generally in a small to medium-sized business what the registered manager is handling day to day, with probably no support or training, which is terrifying, really.
Yeah, and it's these SMEs which, through our consultation, and we will put, there'll be a press release coming out soon about what we found, but it's these SMEs who are the ones that are really worried that they're going to close. They're the ones that are saying, actually, I mean, I've just had an email from someone, I won't say who, and I won't say what it was really about, but they were basically selling their business now because they just can't cope with it. They're just not being able to financially survive. Richard, where's it all going wrong? What's causing these delays?
I'll give you some of my views, but I just think on the point you just made there about providers potentially shutting down shop. We did a survey, the Sector Pulse survey, between Kerrington and HFT at the back end of last year and published findings in February, and that generated some really useful information that validated some other surveys that have been out there, that around a third of providers have considered exiting the market in the last 12 months. And that increases to about 50% for smaller providers. Now, that doesn't mean they're all going to exit, but they've considered exiting because those reserves are down. And about 42% have handed back part or all of their services to local authorities. So where's it going wrong? I think in terms of it's the process, and Mark alluded to it, when you've got all of those complex processes dealing with multiple local authorities or ICBs, changing processes. But social workers, very often we see social workers making mistakes on the referral documents and paperwork. They're not uploading the packages of care necessarily into their brokerage systems or teams correctly. They're not handing it off to the next stage of process because they are so busy. They've got massive caseloads. They're challenged themselves. So they do make mistakes. We're all human. Some social workers, and a lot of social workers are leaving. It's just the same as we find with kind of carers and senior carers within social care. So information is not being passed on to colleagues. I think timing and delays in assessments. I know we've got one ICB that's on FNC. They're 11 months behind in their assessments, and that's had a devastating effect. One provider was £60,000 in debt for FNC payments alone. Changes in funding from local authority to CHC and vice versa. That process of transferring from one funder to another is incredibly complex. So very often they will work with the resident or the next of kin, but they don't work with the care provider because they hide behind GDPR. The discharge to assess funding, that 4-week process, magic for the first 4 weeks. You've got you've got your fee, and then 4 weeks and a day happens, all funding stops, and then you've got to try and scrub around to find out who the hell's going to fund this resident. The extensions to existing placements as well, whether someone's been on fast track or a different form of placement, that can be incredibly challenging to figure out who the hell is going to pick up the funding. Residents being admitted into care homes without clear funding in place, and that very often it could be that maybe they've got a property involved and the local health authority hasn't finished the financial assessment, but the person has to be placed because they're coming out of hospital, or they're coming from the home it's not safe to live alone. And the local authorities' payment system and shared business services for the ICBs make mistakes. They ask for a myriad of different requirements. Please put a purchase order number on every invoice, put the client reference number, and if you get one digit wrong or one thing out of place, the invoice is rejected, but potentially the whole batch of invoices rejected and you won't get any payments. And silly mistakes. There was one provider told me they had £300,000 paid into an incorrect bank account by the, I think it was Shared Business Services only a few weeks ago. And I said, that's surely just a one-off. And he said, no, it happens quite frequently. The money's gone to the wrong provider. I'd be probably quite happy if I got 300,000 into my bank account. Yeah, and unresponsive ICBs and local authorities. So you've got an issue, you've got a challenge, and you just hit a wall. No one wants to talk. I think they're the reasons why these payments go over that 30-day and sometimes up to 6, 12, or months or even longer.
Yeah, and I think there's so many points there, and I'll try and touch on some of them. But I will say, shared businesses is it's hideous, it's gross. I used to hate using it to invoice people, and I very much think there's an element, and this is nothing against health services or our health colleagues, but social care is not the NHS, and we're not used to these processes. We're not used to the sort of complexities of some of these invoices, and I think sometimes it's a case of asking social care to catch up straight away to the NHS process, and actually not NHS going, actually, how do we make this more accessible to social care? How do we make this easy for providers to be able to access and understand? Because I remember we had errors on our invoices, and our system would print or generate the invoices with a number, and as soon as you've submitted it and it's been rejected, it was like, oh no, we can't accept another one with the same invoice number. Oh my gosh, now how do I change this? How do I put a different invoice number on? My system won't let me, and it does drag on. For me, I think there's very much this rush to get people into care, whether that's at home, whether that's in a place of care, but everyone's so quick to make sure that someone's supported. As soon as they get that support, there is a drop off then on communication. Oh, they've got support, so they're no longer crisis. No, that's great. That's great. We've arranged it. I need the contract and I need paying. Oh, no, but they're not high risk for us now because we know that they're getting their support. And I do think there is an element of that. Or you get someone in your services and within 3-4 months, their circumstances have changed, trying to get them reassessed, trying to make sure that they're going to get the correct care that they possibly need, trying to get them to say you can't handle them any longer in your service. And this is sometimes things people don't see. You can't just get rid of them, which sounds awful. You can't just move them if nowhere else can take them. But if you don't get the funding to meet their needs, you end up having to put care in place without a funding stream there to support it. You increase your support, they're not getting reassessed, the system's not going to meet their needs, and actually you're now out of pocket because social care's got a bloody big heart, and we can't just see people without. And I think that's played on sometimes. That's just my opinion. I'm not saying that's fact, but I think people understand social care's got such a big heart, we will never see people without, and it ends up doing us a detriment. But there is a lot going on that isn't working. Mark, what are your views?
No, I think just following on there, I think, again, looking back at learning disability service, I think that's completely entirely true. You support people for years until they hit, 65 when they can move into an older person's service. And their needs have obviously changed. They're a completely different need than when they very first joined the service. And I remember fighting tirelessly, for the support for people that maybe needed around the clock, one-to-one support, that were now bedbound. And the answer was always, well, we'll move them into, the older people's home up the road because they've got capacity. And I think listening to you there talking about, we are willing to go above and beyond. Actually, I think care providers are. I think there's probably thousands and thousands of care homes up and down the country providing care that's not paid for on top of the money that they're owed, because they don't want the resident or the person they're supporting, not because they don't want them to move out, but because they've built those relationships. Some of those have lived in those services for years and years and years. They know the staff, they know their fellow residents, and that's their home. And my argument is always, if people have lived there for years and years, wasn't the whole thing with the CQC one home for life, not moving people around just for the cost?
Yeah.
I do think, I mean, I agree with everything you've said, and I think there is very, very poor communication along the way. But I think we as providers also have to, we've got a part to play in the process. I mean, yes, I think the ICBs and the local authorities really are challenging the way that they are trying to pay us. But I think we as providers, there is poor communication, so we can do something about that. We can act quickly and swiftly to stop these issues developing at an unreasonable rate. But making sure that we do understand the local payment process, making sure that we do raise our invoices correctly in the right way, in the right system, with the right purchase order numbers, the right resident numbers, that we match our schedules to our payment runs and invoices correctly. And we can do our bit as well. So it's not all on the side of the local authorities and the ICBs, but it's made far more challenging than it really needs to be. And I think there are solutions and remedies, but it doesn't need to be quite as complicated, I think, as it currently is.
Yeah, and when you were just saying that, Richard, I'd love to. Where's Katie Thorne when you need her from Digital Social Care? Because I'd love to know how many social care providers now have an NHS email. Because most services, when you need to contract with the NHS and you need to get paid by the ICBs, you're required to have this email now. And I remember I was one of the first to sort of take it up on offer because I love getting stuff and it was shiny and it was new. But even when I left being a manager, there was something like only 50-60% of social care providers had signed up to get this NHS email. And that's just one simple thing that you can do to expedite your ICB payments, to expedite your ICB contracts, or actually get ICB contracts, is make sure that you've got Katie Thorne, do you know? Hopefully she's listening.
I've tagged her, hopefully, fingers crossed.
to make those payments quicker. So you're right, Richard. It is very much a sort of not an ICB and a local authority thing. As providers, we've got our own responsibilities, and we should be doing as much as we can to chase them up and to make this process easier.
I think you had to jump through quite a few hoops to get an NHS email. I mean, it wasn't just a case of saying, "Oh, I have an email address." You had to jump through a lot of hoops, and you had to do a lot of work to try and apply and be approved to have one. Make sure you got the right levels of security and infrastructure. It wasn't made very easy, but rarely are NHS processes made easy for care providers.
No, that is so true. That is so true. So, I mean, we've looked at where we could be going wrong and where things are going wrong. And I know we've spoken about businesses closing, but the impact of this, and let's say, people do exit the sector and they sell their businesses, or they just close down completely. They've not even got enough as an ongoing concern anymore. There's nothing there to sell. What's the wider impact of this on social care as a whole, but really to people who need services? So if this doesn't get rectified and we've not got, because I think our call to action is basically make sure we're not leaving people longer than 30 days for payments. And if we are, either whack some interest on, or we need to be able to have processes in place to fix it. What's the wider ramifications for social care?
I think we're pushing providers to the very edge. I mean, there was one organisation I was talking to, and they're a larger provider. So they've got a team of people who work on these invoices. So they're employing people to manage payment processes. So we're incurring significant costs just to try and manage the debt now. And I would imagine even in the small independent providers, they're spending a huge amount of their time and resources, effort and energy, which is detracted from running the rest of the business, on managing and servicing this debt. And I think that there are some solutions that are available in terms of charging interest. There is a statutory ability to charge up to 13% interest on late payments, and to charge between £40 and £100 for every transaction that's delayed past 30 days when you're invoicing the public sector. That's a statutory obligation. I'll try and point you to that so you can pop it into the chat. but I think in terms of national process for billing and invoicing, it would be great if we could have some standardisation nationally, not just at a local authority and individual ICB level. We've got 42 ICBs and about 15 different ways of processing an invoice currently. Some have actually said they want to go back to faxed invoices, which we moved away from a long time ago, and scanned invoices, sorry, not faxed invoices, which is ridiculous. Clear contractual terms and consequences for breaches are absolutely critical as one of the solutions. And the ability to part pay undisputed invoices rather than withholding all of them, because otherwise we are going to see providers struggling to make payments to their staff or to pay their invoices. And if you're unable to pay your invoices and your bills on time as an organisation, that affects your credit rating. If your credit rating is affected, when you go to renew your insurance or your energy, you pay a premium for that because you don't have a good credit score, so you're considered a high risk. So you have to pay more for your insurance, more for your energy. So it's a bit of a self-fulfilling prophecy, really. The offsetting point that you said as well, Adam, I think a local authority can, if they've overpaid you or are owed some money back, they just whip it off your invoice. Where we don't have the ability as providers to be able to do that. And I think we just need to maybe stop local authorities and ICBs hiding behind GDPR, because actually, if you're making a change to a resident's funding, it's great that you communicate with the resident and the family. That's absolutely wonderful. That's what you should be doing. But you need to make sure you communicate with the provider, because the providers end up provisioning care free of charge for a significant period of time. And if we don't solve these problems, we're just going to see more providers saying, you know what, I've had enough. I'm shutting up shop. I'm sitting on a great piece of real estate. Now is the time for me to sell that to the developer because they're desperate to buy my land. We've got 50% of care homes are over 30 years old in this country. They're not necessarily set for the next couple of generations. They're not going to meet net zero targets. They're going to have to offset. They're going to incur costs to sustain themselves going forwards. If they're not able to run efficiently and get their money on time, they're probably better to say, look, let's get this sold, raise it to the ground, and someone come along and build a new home. And we need all providers because we've got an aging population. And we do have pockets of the country where we've got an overcapacity currently because of the coming out of the pandemic where occupancy was down. So there are a lot of empty beds. There are some spaces. We're starting to see some home care providers now say, hello, can I have some more business? Because I've got capacity, but we need that capacity for the future because demography, the aging population, we are going to need more beds. By 2050, we're going to need a lot more beds, and it's going to take us a long time to get there. And there is a role for every care provider in the land to play over the next 25 to 50 years to get us where we need to be.
And we're not going to get there with false starts, are we? So if we're already saying that we need to have more beds yesterday, we're not going to get there if we're losing beds faster than we're actually taking beds on. And I don't have the stats to my head. It was in our people plan, but it was something like we'd lost so many care homes from the last 6-year period. So yeah, it's great that X amount of care homes have been built in. We've got new care homes, which is fab. But actually, we'd lost something like 3 times as many from the sector, from people just not being able to sustain themselves. And be that Brexit, be that COVID, be that delayed care payments, be it other stuff, just not being able to cope anymore, because 8% of the sector is SMEs, and if their directors and proprietors are at an age where they think, actually, I can retire now, and that's great, let's either just sell it or close up, we are going to be losing these people. I mean, the other thing that I can think of is, and I know, Mark, you see this from your side of things, it's just going to add on delays to discharges, because if we are struggling to get people on contracts for care, they're just not going to get discharged anywhere. And we're going to see the hospital beds fill up. And, I hate the term bed blocking, but then that really will be a sort of blockage in the system. And I just worry social care will get the blame for that. Again, it's, social care cannot meet demand. Well, actually, social care could meet demand if we were getting paid for the care that we had originally provided. It's not that we can't or don't want to meet it. It's you're stopping us from meeting it by not paying us. And there's only so many ways you can say that without feeling disheartened. Now, I've spoken to someone recently who has taken a contract of care out. It would have been great if they could have joined us tonight, but they've been supporting this person for the last 15, 16 months. It's a huge package, and they've not yet been paid anything for this package of care for the last 16 months. So I think, the fact that they can add 13% to their invoices will be music to their ears this evening. Plus the additional cost on the transactions for the invoices. I'm sure we'll get that data to her and support her with it. But she could have easily turned around and given that package back, and she can't because she knows that person is not going to be able to go anywhere else. But it brings up another problem, and this is a contracted from a local authority, but the local authority outsourced the invoicing to a different company. So it's not actually invoicing the local authority to direct themselves. So it's adding a third party into the situation. So the local authority are basically going, nothing to do with us. You've got to invoice these people, and you're invoicing these people, and they're just ignoring you. There has to be a point where actually accountability has to come back to the contracting organization, be that ICB or local authority. So what sort of, let's say we're struggling to get paid, we're struggling to get our invoices paid, what sort of things can we do? What are the basics we should be doing first? What should we be doing as providers?
I think that some of the key points are check your contracts. Always, whenever something goes wrong, check your contract that you have with the local authority, the ICB. What are the remedies in the contract? What is the complaints process, the escalation process, the reporting process, the notice process? What do you need to do according to the contract? Always put issues in writing. Create the paper chain as if you were going to go down the legal route. Because if you ever do have to exercise your rights legally, you need to provide that bundle of evidence. So confirm every conversation and email with a named individual. Record dates and times of what you've done, when you've said it, because you need to make sure you can get money back to certain dates. Use the local authority and the ICB complaints process. These have got a 28-day window to respond. So you can manage them. They have to report those. They're publicly available on those pages. They're anonymised, but it does get reported. So if complaints are made against authorities against those complaints, use the local authority social care ombudsman as well. That's a fantastic route. So once you've gone through the local authorities complaints process, so you try everything you can, you go through the local authority complaints process, escalate that to the local government social care ombudsman process, because they again will intervene and investigate. But they'll only do that if you follow the contractual process and the complaints process of the local authority and the ICB. You've always got the threat of handing back a package of care. Now, that's not a nice thing to do because we've got service users at the end of the day here, and we don't want to see people unnecessarily removed. But if it is affecting the sustainability of your business, you have a duty to make sure you say to the local authority, the ICB, that unless you remedy this within this period of time, I have to hand this package of care back because it's not in the resident's best interest. Otherwise, safeguard is going to be raised against you, the provider.
Yeah.
Write to your councillors, the leader of the council, the CFOs of the council, the chief financial officers, that is the directors of adult social care. Use your local MP if you need to. If it gets that severe, use those resources, because these people do have a duty to respond, and they will respond. It's not always quick, but they will respond and they will get involved. I mean, you do have your local media. I would say be careful with that, but there is local media out there if you need it. Take legal advice. So from Care England, we offer members, and we're about to promote something to non-members as well, to give a bit of free legal advice here and there within it. So a 15-20-minute session with a lawyer to understand what your rights are. Charge interest on late payments. When someone suddenly sees 13% applied as a late payment charge, they're going to start making a change, because most local authorities and ICBs have not got an extra 13% to play with. Stop emissions. If it's going to hurt you, stop taking people in. Don't fuel the fire. Solve the problem, solve the processes. Maybe see, well, can I focus on a self-funder market? Try and get more self-funders in. Maybe have less self-funders, but at a higher fee than what the ICB or the local authority are paying to solve this problem until we can fix those core problems. But be indefatigable, be tireless in what you're doing. Don't give up. And use your local care associations, the national care associations, Care England, NCA, NCF, whoever you're associated with. Use those associations to help you if you're having challenges with local authorities.
You bring up some really interesting points, and Mark, I want to bring you in on some of this, because talking about handing packages back, not taking on local authority funded packages, and focusing on self-funders, all really logical, essential steps that we need to be taking. However, from an outsider's point of view, who doesn't see the functionalities of a home and the requirements of being able to meet this financially, is usually when the negative press starts. Oh, self-funders footing the bill. Oh, this person, this home only takes on self-funders. They don't care about people who are on local authority rates. And actually, 9 times out of 10, I bet you it's not the provider's choice to do that. It's the fact that either the local authority won't increase the rates to meet national living wage, or they're not paying people. So, Mark, this is something we see quite a bit, isn't it? How do you think we change this narrative now? Is it something we should be doing at the Care and View, to be saying to people, look, this is why people aren't taking on local authority packages?
I think a lot of it comes down to communication with the relatives and the person that you're supporting, if they have capacity and really understand, the dynamics of what's happening. And I draw on my own experience, of having to threaten to evict people from the care services that we were using, but actually having that conversation with them, with their family, and say, well, actually, this is the very last thing we want to do, and we'll involve you in every step of the way. But actually, this is the only way that we're going to get the local authority to move. And that was even around, uplifting fees, because cost of living was increased, and you'd get 1% increase, and it didn't cover the cost, that you had to pay your staff. It just made it completely financially unviable. So I do think communication is key, so that everybody's on the same picture. What I used to do is advocate that the relatives also used to get involved, like Richard said, contacting the local MP. Quite often they don't live in the same, area, so contacting their own MP, so you've got kind of double ammo kind of going at it all at once. I think Richard spoke about utilising, your local care association. I think utilise your local care providers as well. So in Essex, there's a registered managers chat group, there's also a learning disability in Essex WhatsApp group, and actually utilise those groups. If there isn't one, start a Facebook group, but get your voices heard and come together, because a bigger voice is better than, all the smaller individual ones. I think my only worry from what I've seen is, care providers close or they hand people back, and especially in home care, and then there isn't another organisation that can pick up that care needs. So actually what we're now finding is there's a lot of carers doing private care on the side, cash in hand job, which is fine in the first place because, they've probably got the up-to-date DBS, they've had the training, but actually over time, and I know carers now that I worked with years ago that, do it, but they haven't had a DBS in the last 8-9 years. They haven't had any training in the last 8-9 years. They're not, paying into, national insurance and everything, as we all are. And actually, when those carers, go on a holiday, or if they're unwell or something happens, the person that's being supported is right back at the bottom again without care and support. And I think it's a really worrying thing. And I do wonder whether actually we're going to see more private carers pop up as a result of obviously care providers closing, because I think, word soon gets around, reflect back on some of my friends that I've got that do it. It was only one of them that did it originally, and now there's probably about 10, 12 of them that do it. So I think once they know, it's out there and it's easy and there's a continuous demand in work, why be paid, minimum wage when actually you can charge, 28, £30 an hour and, reap the benefits yourself. So I do think that is a worry. I don't know. Richard, the question I had that I wrote down while you were talking is, do we think that the introduction of ICBs has actually made this problem worse because there's another funder in the circle? And also, what are your views on raising a safeguarding against the local authority or whoever it is that isn't paying the invoice? Because ultimately, it should be a form of neglect, because actually the provision of care is going to be impacted if they don't pay that invoice.
Misappropriation of funds, potentially.
Yeah, well, I mean, local authorities and ICBs have got a duty to spend public money, wisely and appropriately. I think, has the ICB situation got worse? I think we've always had problems. When we had a significant number, a higher number of CCGs, it was challenging for lots of different reasons. I think ICBs were thrown under the bus to a degree, having to sort of consolidate the process, and so we gave them a bit of space over the last 12 months to get themselves together. I think some ICBs are more progressed than others. I don't think it's made a huge amount of benefit so far. I think it's as challenging as it was when it was CCGs, and finding the right contact in ICB. You seem to go into a perpetual loop of mail groups and 40-minute holding on telephone lines to try and speak to someone to resolve an issue, and then you get cut off and have to go through the process again. So I'm not sure it's made it any better. Has it made it any worse? I'm not convinced. I think the challenges were always there. I think we're just struggling to get access to the right people at an ICB level. I think safeguardings are a vehicle. If safeguardings can be raised on you as a care provider, then you should raise them on other people if you think it is to the detriment of the quality of life of the people that you care for. Then absolutely. I think there are other vehicles that are probably more suitable when it comes down to delayed payments. But if you think a resident or a service user is being impacted, then absolutely. If it's negative, then you should raise a safeguarding because they are reported. Minor safeguardings are just as valid as the major ones because they prevent and stop things becoming more significant. So if you feel that you can exercise a safeguarding, then please do so. But I think I would use the LGSCO and the complaints process as well as raising the safeguarding, but just use any resources you've got to drive this point home. But I think the most important thing that you said earlier, Mark, is the power of the collective voice. You might be a single voice fighting your battle, but there are probably another dozen people in your postcode or in your area fighting the same battle. So use the power of collective voice to argue that point. And that's where the associations and the local community groups come together and really do make a big difference.
And you know what, Mark? I think you have got probably the nail on the head there. Because I come from, so I'm Lancashire. We don't have a care association. We don't have that care provider voice. We have got registered manager networks. We've got loads of them. But I really do feel like there is that sort of power in numbers. And it's not, we always talk about how social care can't just go on strike. We can't just shut up shop. We can't just not go in one day. We can't just do what the NHS are able to do. We just don't have the ability to do that. However, if we did all start getting our numbers together and started saying to people, actually, if you're not going to pay us, then actually anything local authority required from us, we're not going to provide. We won't do your quality compliance. We won't do any of your data that you need. We won't do any of this. Yes, it's a sort of regulatory requirement, but actually we can't afford to do that. And the money's coming from you. So until you pay us, we'll not provide you the services that you need us to do. Again, I know that if it was one provider doing it, yeah, CQC will be around there like a shot and you'd get your regulation on. But if we can come together as a sector and go, actually, we're all going to do this. We're all not going to support you. We're all not going to respond to you as you need us to respond because you're not paying us. They would have to start changing the way they do things. And did you say it was 30 days, Richard? After 30 days, you could start applying interest?
Yes, yeah, there's, I think we said that you put the link in the chat, but if you're working with the public sector and payments, if you've got a contract that says payment 60 days, it's 60 days. But if it's silent in the contract, then it's implied that it's a 30-day payment window from either the date of invoice or when the service commenced. And if you are over 30 days, you're entitled to charge interest on a daily basis. So it would be 8% plus the Bank of England base rate. So I think that would currently be about 13%.
5% at the moment is shocking, isn't it?
Absolutely. But yes, you are entitled to. And when an invoice is late, there is I think up to £1,000 you can charge £40 per transaction. If it's between 1,000 and 10,000, you can charge 70 quid. And if it's over £10,000, you can charge £100 for your time for managing that late payment process. Now, that's not a huge amount of money, but it's money you're entitled to as care providers. And actually, if you start applying interest to late payments, local authorities and ICBs will suddenly say, whoa, this is costing us X amount of £1 million a year. We need to do something about it. But we must recognise that providers do make mistakes as well. It's not always due to the majority ICB. I think primarily, very often it is, but sometimes providers have got some skin in the game as well. So they need to make sure they get things right.
Yeah. So paper trail, check yourself first. Make sure you're not the one in the wrong. And if you are in the wrong, hold your hands up and go, I'm sorry. I've rectified this now. And then start your trail from when you've rectified it. Because once you've rectified it and you're no longer at fault, start your 30 days, and check it. Check your contracts. Make sure your contracts are either silent or get the dates from them. And then if you are in the right and you aren't being paid, I would be petty. I would be there midnight, right? 31 days, still not been paid. Right, I'm starting interest from today, and I would do it on every single invoice until they get the idea that you want to be paid on time. And I mean, I can say this: I'm no longer a provider. I'll take my professional hat off. Get petty. Start, charging people. How do we fix this, Richard? How do we get this changed? How do we make it so that actually there isn't a statutory requirement from commissioners, from local authorities, from ICBs to pay providers on time? How do we make this happen?
we need to lobby. We need to lobby for this. So we need the power of that collective voice. We need issues to be surfaced and escalated. We need people to be able to raise their concerns and say and report and provide data to evidence how this is impacting the sector. And you talked earlier about a provider who potentially needs to exit the market because of this issue. So we need those stories to come to life, and we need to use them as evidence. How do we solve it? Local authorities are stretched. They've got really stretched resources. They're underfunded by central government. So we need to work with our local authorities as well as work with them and challenge them to make payments on. But we need to work with them to provide the evidence to push it up to central government to say, look, you need to fund local authorities appropriately so they can fund adult social care. They're restricted on their resources. They're running very thin on the ground. They've got a social worker crisis. So they need to make sure they've got the right level of funding so they can establish their processes to make sure that they can create efficient payment systems for providers. So we have a duty to do that. That's both an NHS and a local authority level. But I think we need to lobby for statutory rules on what happens. So we've got really clear guidance from above, from the upper echelons of government, saying that if care providers are owed money, that there is a process by which every local authority and every ICB will follow to make sure those payments are made efficiently to care providers. And we do have to lobby for that.
Yeah, no, I fully agree. Mark?
I think for me, I completely agree with everything there. I know that I've spoken to care providers that have got various different invoices from various different places that need paying, and they just don't know where to start. And my advice would be just block a day out of your diary, either in the office, at home, wherever you know that you're going to be able to get your head down, and just create a spreadsheet with all the outstanding invoices, the date you submitted it, and a complete, like Adam said, and paper trail. So actually when one's been paid, it's been paid. You can highlight it yellow, green, whatever color you want to do, but then you can see clearly which invoices are outstanding, when you originally raised it. I think the other thing to remember is that the local authorities are soon going to be inspected by the regulator. So actually that can go in your favour, because they're going to be coming to care providers for opinions on what the local authority is like. So if you're owed money, you can make sure that you raise that, or raise it with a complaint with the CQC, because, as care providers, we all know if there's a number of complaints with a similar theme, they come and inspect. So actually, don't be afraid. You can do it anonymously. You can do it with your name to it. But yeah, don't be afraid that actually you might need to actually report them to get some movement, because once, the regulator's involved, I'm sure they'll probably move quick snap. But yeah. Adam,
I promise not to be cynical and go, CQC regulating local authorities. Oh, that's going to happen soon. I promise I won't be cynical and do that. I promise I won't feel like, actually, I'm sure it was supposed to start around April time this year, and actually nothing's really happening yet. I promise I won't be cynical. But you are right. Once the regulator has that power to go back to the authorities and go, look, you're not doing things properly. But I would call into question the parity of regulatory action. I always say you can't just shut down a hospital because we need them. And yet, actually, social care providers get shut down all the time. And I do think enforcement from the regulator needs to be the same for everyone. If you are inadequate, you get shut down within 6 months if you've not improved. And I think if a local authority had that threat looming above them, great. I just worried that the sort of repercussions of having a bad CQC report from CQC for a local authority just won't have the same impact as it does for providers. But I agree. I think there's a lot that we need to be able to do. I think we need to get people on board. We need to work together. You're right, Richard. We can't be working against everyone all the time. We have to be able to go, actually, yeah, you local authority, you're not doing what you do, but actually, can we work together to fix this? Can we come together to sort this out? We always talk about how social care is fragmented. It will be fragmented until the day we decide it no longer should be. And it doesn't mean we all have to come together and be one organisation. But the minute we realise competition is a bullshit approach, and actually we can work together to change the way things work, and all care homes need to exist because there's plenty of people to go around and the population's ageing, that will change the game.
I think that's incredibly important. I think what Mark said is really important around using your CQC complaints process, the local authority complaints process, because they are registered and logged. So when the market oversight kicks in on local authorities, they will be looking at complaints. They will be looking at complaints raised on the local authority and also on the CCG, but they will also accept your anonymous referral to them if you want to kind of suggest that this is becoming a problem and it's affecting the sustainability of this sector. But I think to evidence the power of collective voice, when I started working with Kering about 10 years ago, I was working with one of the larger providers, and we as larger providers at that point never really spoke to each other. And I asked Kering to set up a group, and we've got a group now, the Public Funding Steering Group, and it's a group of larger providers. There's about 8 or 9 providers who come together, and we collectively lobbied for FNC, and we saw FNC, and we worked really hard lobbying FNC for several years. And back in 2014, 2015, when FNC was £112, we did a huge amount of work, and our collective voice and the lobbying we did got it to £156. And we've lobbied really hard every year. We're probably the only association that really lobbies hard on FNC, because we've made it our mission to do so. And we've been at the forefront of that work with our collective voice, with the power of lots of providers behind us, all of our members. And in 8 years, we've had FNC go from £112 to £219. That's fantastic. And that's the power of the collective voice. And we can do exactly the same thing again with delayed payments and invoicing. When we've got financial challenges, our coming together and that power of that collective voice is so incredibly powerful to speak to local authorities, to speak to ISPs, but more importantly, to speak to government, to say, you need to help fund this sector properly. We need that extra 20 billion injected into the sector before we can pay our staff the £15 plus an hour that we want a carer to be earning, so that we're not having to subsidise, or our self-funders not having to subsidise it. It will then help us to fix all of those system problems, challenges, recruitment, retention. All of those issues will be fixed if we get the funding. It's not going to happen if we don't raise these issues to the surface.
Yeah. I mean, Mark, I was going to suggest, I completely agree, Richard, and lobbying, I think, is the way forward. And I know the Caring View, we'd put our voice to any sort of good cause to change things for the better. And I would go, we need some sort of petition going, but I think the numbers are so high to get them discussed in Parliament, something like 100,000. We'd struggle to get that number from providers. So for me, it's making sure that everyone understands the real risk of this and the real sort of requirements of making sure these payments are on time to get everybody invested, providers, your teams, people who use care, who might need care, who will need care, to basically go, actually, yeah, this is a problem and we need to fix it. Let's get it sorted. Local authorities, I'm sure your local authorities want to fix this. Let's get it through them. So Mark, the master, the prince of petitions, I'm trying to think of some sort of alliteration to go with this. Maybe it's something we can get started. Maybe it's a beginning of a lobbying thing we can do to actually go, let's get this changed now. This is why we need to do it. And this is how many people are supporting us on it.
I would hazard a bet, if you had a look, there's somebody that's probably started one already. But that doesn't mean that you shouldn't join into it and actually, as a provider, if you find one, sign it. But yeah, no, I'll definitely have a look and see whether or not I can source one. But yeah, 150,000 signatures you need. I think my only worry would be that there wouldn't be anybody to hold accountable for that petition, because it'd be so many different local authorities and, account funding, but you'd be able to do it locally. So I obviously live in Essex. I could start one locally against the local authority here, but then you'd have to have another one in Hertfordshire and XYZ, wherever you are. But Richard, any advice on kind of lobbying, what you've done, kind of uniting people together for a bigger voice?
I think the key thing for me is that we've all got survey exhaustion at the moment. There's a lot of surveys going around the sector. CQC have launched one yesterday. There's another one coming down the line. We've got Skills for Care. We've got all of the different associations. And I know that's really challenging, but all of these bodies are putting those surveys out, not just to feather their own caps. They're using that data to go up to government. So I would just really urge providers, wherever they can, just invest that 5-10 minutes here or there to complete the surveys that are coming out, because all of that information collectively gets filtered up to government. It does arrive there. So I think that's probably the key thing. We've got lots of big surveys coming up over the next few months. And if you can invest some time as providers, and there is a carers survey that's going to be coming out very soon. If we can get our carers to invest in that, that information is incredibly helpful for the sector to use to leverage our position and push data up to government. I think the Skills for Care data gets reported in October, but there's a little snapshot around the middle of July. That's going to be really helpful. We as the associations use that to lobby going forwards. I think we could probably think about creating something better on delayed payments and how that's impacting providers to try and get more data together to use that to lobby government. But I think we've got a lot of work to do to try and raise this issue and show just how much this, you know, £600-700 million is having a direct impact on care providers, and actually what that would cost in interest to the public sector if we all started charging interest. Because that, you know, when the government gets an extra £80-90 million bill, I think they'll start to listen.
I think, yeah, I mean, all you need to do is put, let's just say 700 million into a calculator plus 13%. We'll soon see how much of that extra money. I mean, Hillary's come up into the chat quickly before we close, saying we need a survey platform. Again, Mark, not that we do enough. And for everyone who does not know, Mark and I do this in our own time. We do not get paid for the Caring View. However, we do accept sponsors to help us keep things running. But Mark, maybe we should start having on our website a list of all the current open surveys. Because people, I mean, we get thousands of hits on our website each week. It's incredible for everyone who still supports us and who joins us each week and who visits our website for the resources and what have you. And I actually think it'd be a great place for people to come and actually see what surveys are there so that they can do them while they're there as well. Come get your free resources on a Friday, have a brew while you're doing it, pop the podcast on and fill in a couple of surveys. There you go. Bob's your uncle. Let's start changing social care.
Let's do it. I mean, I'm not the person that manages the website, so I'm saying, yeah, go for it, Adam. But
knock yourself out, buddy. Oh, Mark, Richard, any final thoughts before we close the night out?
No, I think it's been incredibly positive, and I've looked at some of the chats and the comments are really positive there. I know it's a huge issue for care providers, but we're here as Care England. Even if you're a member of Care England or not a member of Care England, you know, use us as resources, write to us, keep us informed by yourselves or directly with what your key issues are, because that we can only lobby government when we know what the key challenges are, what the problems are. We do a huge amount of work with the LGA and ADAS, and they are doing, I have to say, fantastic work. If you read the ADAS report recently, they really do. They are struggling as local authorities and what the solutions are that are needed. They're doing incredible work to lobby for the sector, as are the trade associations, the Care Provider Alliance, Care England, and all of those that make those up, the 50, 60, 70 local care associations within the individual councils. Use our resources because we are all filtering up to the Department of Health and Social Care and NHS England and really driving those messages home. So just a big thank you to everyone who does support us.
Thank you, Richard. And thank you for joining us tonight. It's been a really, really good show. Mark?
I think the only thing for me, whether you're a manager, a director, a business owner, don't struggle alone, because it's clear from tonight's show that you're not alone. There's thousands of other people that are struggling alongside. So even if you need to find somebody just to offload with, reach out to Adam, either Caring View, obviously to Richard, Care England, and just find somebody that that you can just bounce ideas off. But yeah, make sure that you don't struggle kind of behind the scenes. And if it's getting really bad, then obviously you need to seek kind of legal support, support from your local GP around mental health support. But yeah, don't struggle kind of in vain, because it's not going to get you anywhere.
I just want to echo what both of you said, as well as wait for that 31 days and then start charging interest. Be petty. But no, I think it is. Let's get together. Let's work together. Let's get this idea of fragmentation out of our heads and realize that actually we can be united and we can have this unified voice to make things better. Do not suffer and try not to give up. I know that's easier said than done, and I know days might seem dark and nights might seem long and restless, but if we can work together and not give up and try and make things better for everybody, then social care might be in with a sniff of a chance of surviving this next crisis that probably will be thrown at us. We probably will just get there and it will be fine, despite the articles coming out today around how overseas recruitment probably isn't the best idea. And I know it always seems like there's something negative being thrown at us, but if we can be shown to be working together to be the solution, then I think that negative public perception of social care will die down, because they'll see us working hard. They'll see us creating the solutions that other people have failed to do for us. And that can only be a good thing. So I just want to thank everyone who is listening and watching this, who is still day by day going through this and struggling. That Mark's right, we are here. If you do need to talk, please do just pick up the phone, drop us an email, get in touch. And just a thank you for everyone in social care doing what you're doing. It's hard, it's tough, but we we fully respect and appreciate everything you're doing. Yes, do go visit Care England. If you're not a member, go become a member. Why not? It will benefit you. It will benefit the sector. Don't forget to subscribe to the Caring View. You'll always catch up on our episodes, anything that we're doing. It is Care Home Open Week this week. So go and visit championingsocialcare.co.uk or championingsocialcare.org. I'll probably get shot for getting that link wrong. And go and visit Napa as well as the Care Workers Charity, because they are both supporting Care Home Open Week, Ciao, as it is, #Ciao. And they've got lots of free resources for you to do. Yep, there we go. Hillary's popped the link into the chat for you. And be sure to check out our podcast, go to our website. Most importantly, stay safe and carry on being fabulous. So, Richard, thank you so much for joining us tonight. Mark, as always, great to see you. If you are heading to the Care Managers show, we are opening the entertainment stage Friday and Saturday this week. We have got freebies to give away, and we have special gifts for one lucky person per show. So do get yourself down there. It is free for Care Managers. But until then, we will see you next Tuesday for another show of the Caring View. Good night. Take care.
Thank you very much, Richard. Good to see you, Adam. Bye.